All right. Hello and Hafa Day, everybody. I'm Jason Salas, and welcome to Hafa Health with our friends over at FHP. I'm very glad to have along for the ride today, very fittingly because March 6th, you may not know, but I want you to celebrate because it is National Dentist Day, and we have someone who has dedicated her life and her medical practice to making sure that you have the nicest set of choppers, just like mine. I try and practice good dental hygiene. So Dr. Martini over at FHP. Doc, so good to see you again.
Same here, Jason. Good to see you too.
All right, happy National Dentist Day. Every day should be Dentist Day.
Right.
Yeah. Well, what does it mean for you and your colleagues to actually be able to do this kind of work and to tell people how important it is to to take care not only of your teeth but of your gums, of the tongue, of like everything that goes into the oral system, and how important that is to good health.
How important it is for us and the team. People either love dentistry or hate it. Majority of them love. I'm talking about healthcare providers. It's a rewarding field because we make a difference in people's life and help them keep their smile and also keep people healthy. So we take ownership in keeping our patients healthy.
Absolutely. You guys are doing fantastic work. So we appreciate each and every one of you. One thing, Doc, I've never really understood is I understand there's a big difference between amalgams and composite fillings. These two things have very often confused me. So could you differentiate between those and maybe break those down?
So amalgam fillings are silver mercury ones. The white ones, tooth-colored fillings, are composite fillings. I'll just give you a little bit of history. Amalgam fillings have been invented in 1819, and the first car was made 1886, so they predate even cars. And when you look at technology, how the cars looking nowadays, and we still do amalgam fillings, even if they improved a little bit. I'm not a big fan of silver mercury fillings because even if they last, they stay long in the tooth, they cause damage to the teeth. They discolor the teeth. And since there is no glue layer, like in the composite fillings, they end up shrinking, expanding with heat and cold, causing cracks. It's basically like a metal wedge in the tooth that ends up undermining the enamel. So people end up with broken teeth, with decay underneath them. It has its application for when you need the quick materials, when people cannot spend extra money to get a tooth color restoration. So we still use them. However, we have to understand the difference between them.
Well, that is very helpful. Yeah, I know. I know maybe older generations tended to have like the silver fillings, and I know the new kids, the fancy thing to do is to have like, the ones that appear more natural. So thank you for breaking that down. I also understand, Doc, periodontal disease is something that your colleagues talk about constantly. And it's not just, your teeth can become discolored or you may have plaque. The gums could, recede or bleed or, have bad breath. Periodontal disease is a very, very serious thing. And you could develop like serious health complications because of that. Is that right?
Definitely, and we don't talk enough about it. I'm very happy we can talk about this topic today. Our biggest concern is not people losing teeth because of periodontal disease, because we can address that if people have regular appointments. The biggest thing is that bacteria in your mouth spreads in the rest of your body through the bloodstream and cause same type of infection. It can damage your heart valves and kidneys, liver, your joints. We find the same bacteria in Alzheimer's patients, brain tissue, pneumonia patients, which is probably very important now with COVID. Pneumonia patients end up with those infections in their lungs. So there is a correlation with colon cancer and advanced periodontal disease. So like I mentioned before, we don't talk enough about it, how serious it is to keep your regular cleaning appointments and get things addressed early on time.
And I correct me if I'm wrong, Doc, but maybe the past 2 or 3 years, because of human history and what we've all gone through societally because of the pandemic, is maybe some people didn't see their dentist as often as they should have, especially with cleanings, because, everybody was staying home or maybe people were a little bit hesitant and everything like that. But there's no better time than the present to go get your cleaning from a learned professional like yourself.
Exactly. Cleanings and checkups. For most people, not too much damage happened within the last couple of years, not being able to go to the dentist. It's more like sporadic appointments, going when something hurts, not keeping regular continuous care.
Mm-hmm. Yeah, I remember my dentist was giving me a cleaning once, and he said, you really got to pay attention to your periodontal health, because if you have some problems with your gums, that could lead to heart disease. And I was like, wow, that was that put the fear of God in me. From that point on, I'd be like, okay, periodontal is job number one for me.
Yeah, and it doesn't hurt, doesn't stop you from going to work. So a lot of people are not even aware they have it. So.
Sure. Now, we were talking, Doc, a few moments ago, of course, about, the different types of fillings and how maybe that might lean towards the previous generation. But when it comes to the younger people, or even, what they say are younger teeth, do we still need to treat baby teeth, or just the fact that they will fall out, or they'll just, the course of nature, they'll be cycled out and everything like that? Are these still worth treating?
Absolutely. Well, first of all, children feel the same pain like we feel when the tooth gets abscessed and when you need a root canal. So you don't want your child to suffer. Second of all, it's an infection that their body has to deal with. And occasionally we need to give them antibiotics, which can be avoidable. From the dental point of view, if you don't restore cavities in baby teeth and then they get decayed and abscessed, what happens, teeth start shifting. You will lose that space that was meant for a permanent tooth that's coming in. Also, the tooth, the infection can damage the permanent tooth developing underneath. So then the permanent tooth comes in and has white, brown spots, and parents don't understand why. Well, the damage happened because of the infection. And also, if teeth are shifting because they had to be pulled out at a young age or not restored, then orthodontic treatment becomes more extensive and more expensive and lasts much longer, because we lost a lot of space if we didn't save those baby teeth. So definitely.
Absolutely. Well, Doc, again, we're running out of time, but we got to let you go. But I will say I have always had an immense amount of respect and reverence for people that are involved in the dental practice, because every dentist I've ever been to, first thing they always say, they said, okay, I know, kid, you may be like, you look like you're a little bit nervous and everything, but I am your friend. Everyone has always said that.
Good. Glad to hear.
Yeah. So you and your colleagues are doing a fantastic job. So happy National Dentist Day once again. And thank you for what you do for our community.
Thank you, Jason.
All right, everybody. That's Dr. Jorge Martini from FHP. Make sure to go see. I'm going to make an appointment after this. I'm going to get a cleaning scheduled, because I need to, and because Dr. Martini is awesome. So we'll see you next time. Bye-bye, everybody. Thank you, Doc.
Take care.
Thank you for watching this video from Take Care and FHP Health Center. For more videos like this one to help you live a more balanced lifestyle, please subscribe and like our social media pages. And don't forget to turn on the notifications. For more information about Take Care and FHP Health Center, please go to takecareasia.com.